Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. How eosinophilic esophagitis is diagnosed. Eosinophilic esophagitis is a chronic immune disorder that affects the esophagus. The esophagus is the muscular tube that connects the mouth to the stomach and brings food into the body. In eosinophilic esophagitis, a type of white blood cells called eosinophils build up on the lining of the esophagus. This leads to difficulty swallowing and chest pain. /r/n/r/n The diagnosis process for eosinophilic esophagitis usually includes an upper esophageal scope, esophageal biopsy, and allergy testing. This article will detail the diagnostic tools used to test for eosinophilic esophagitis, as well as what to expect when seeing your doctor. /r/n/r/nComeback Images Getty Images/r/n/r/n There is no way to test yourself for eosinophilic esophagitis at home. However, it may be helpful to be aware of the common signs and symptoms to look for. Common symptoms of eosinophilic esophagitis in adults include /r/n/r/n Common signs of eosinophilic esophagitis in children include /r/n/r/n Eosinophilic esophagitis can affect anyone, but you may be more likely to experience it if you have any of the following risk factors. /r/n/r/n If you have been experiencing symptoms of eosinophilic esophagitis, it's time to see your doctor. Your primary doctor will start the appointment by taking a thorough medical history. Because eosinophilic esophagitis shares many of its symptoms with more common diseases like gastroesophageal reflux disease, GERD, a detailed history is an important part of the diagnostic process. /r/n/r/n Your doctor will ask several questions, including /r/n/r/n If eosinophilic esophagitis is suspected, your primary doctor will likely refer you to a gastroenterologist or an allergist. /r/n/r/n The two tests needed to diagnose eosinophilic esophagitis are an upper endoscopy and a tissue biopsy. /r/n/r/n Your doctor will look for the following characteristics of the esophagus during the endoscopy. /r/n/r/n It's important to note that you may have eosinophilic esophagitis even if your esophagus looks normal during the scope. Only a biopsy with eosinophils present can diagnose eosinophilic esophagitis. If the pathologist counts 15 or more eosinophils per high-powered microscopic field, a diagnosis of eosinophilic esophagitis is likely. /r/n/r/n The majority of individuals with eosinophilic esophagitis also have symptoms of one or more other allergic conditions. These conditions can include asthma, eczema, allergic rhinitis, or food allergies. This is why people with eosinophilic esophagitis are usually treated by both a gastroenterologist and an allergist. /r/n/r/n Other diagnostic tests include /r/n/r/n Eosinophilic esophagitis is a relatively rare autoimmune disease. If you have experienced symptoms such as difficulty swallowing or heartburn, they may be caused by a more common disease such as gastroesophageal reflux disease. More common gastrointestinal diseases are usually ruled out before arriving at an eosinophilic esophagitis diagnosis. /r/n/r/n Eosinophils can also be found in the esophagus in other gastrointestinal disorders. /r/n/r/n Common diseases to rule out before being diagnosed with eosinophilic esophagitis include /r/n/r/n In addition to difficulty swallowing, other common signs and symptoms of GERD include /r/n/r/n Eosinophilic esophagitis is a chronic immune disease that causes an overgrowth of eosinophils on the inner lining of the esophagus. Upper endoscopy with biopsy is needed to diagnose this condition. Because eosinophilic esophagitis is often associated with food allergies, allergy testing may be performed as well. /r/n/r/n Common gastrointestinal diseases to rule out before diagnosing eosinophilic esophagitis include gastroesophageal reflux disease, GERD, ulcerative colitis, and Crohn's disease. /r/n/r/n Eosinophilic esophagitis can be difficult to diagnose, and the process may take time. As you attend appointments and undergo various tests, be sure to take time for yourself. This is a stressful time, so using your favorite stress management techniques may help. Reach out to loved ones for support or schedule an appointment with a health psychologist to learn new coping skills. /r/n/r/n Endoscopy should not be painful, but you may experience some discomfort after it. Your medical team may offer you a sedative medication to help you relax, as well as a throat-numbing spray so you do not feel the tube going down your esophagus. Possible side effects of endoscopy include a sore throat, abdominal cramping, and bloating. /r/n/r/n Common symptoms of eosinophilic esophagitis in adults are /r/n/r/n Common symptoms of eosinophilic esophagitis in children are /r/n/r/n Eosinophilic esophagitis is usually treated with elimination diets and prescription medications. Medications for treating EO include the monoclonal antibody Dupixent, dupilumab, the oral corticosteroid Eohilia, budesonide, or a proton pump inhibitor, PPI. If those treatment options are unsuccessful, your medical team may recommend esophageal dilation. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.